Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, Nikki. How are you?
Hi, Annie. I'm doing great. What are we doing? What are we doing today?
I'm so excited to do this research perch because it's just you and we're both in massage education in different ways and have been for a long time. And today we're going to talk about what the Massage Therapy Foundation can offer for entry level education, the
This
resources we have. Yep.
this is fantastic. I always love my conversations with you, and this topic is perfect for us to discuss in Research Perch. So welcome everyone to our
Welcome,
chat.
everyone. And Lynn, let's talk about why it's a perfect topic for you and I. So, first of all, we work together at the foundation. You
Okay.
are the research director, I'm the associate director of operations, and we basically, what do we do at the foundation? Why don't you talk about what you do a little bit?
Right. So I am the research director of the foundation, and this is coming from a long time of being a volunteer. But then in my academic world and career, I am a massage researcher. So I've had a long history in massage and massage education. My initial formal engagement with education happened very soon after I got out of massage school. I became the associate director of the massage school that I went to, and then over time, I became the dean of students, helped with the whole ownership transition, and got very involved in the foundation curriculum development as we went through accreditation, and was a teacher for a long time before I went and got my doctorate.
Yeah, that's perfect. Right now at the foundation, I work on operations, kind of more the back end of the house type of stuff. But I own a massage school. My other part of my life is I own a massage school, and I've been a massage school owner for 15 years, and I've been in entry level education that entire time. I've done some continuing education, but the massive amount of my focus has been entry level education. So I have a passion for
Excellent.
that, and yeah, we both have done that for a long time. But
Well, and I think, and where mine has shifted is as I've gone into full academia, I've continued to have as part of my actually part of my research program is work towards elevating the research literacy and
yeah.
helping to bridge massage clinicians to research in the field. And I have done that through my work looking at case reports and getting improving the reporting of case reports
Yeah.
and in my publications, and then also other different ways of being able to help improve the research literacy of the massage field.
And we are going to talk about case reports today because that's such
Yes.
a great avenue. Both of us, I mean, it's why we work for the foundation. It's why we do what we do, but both of us have a passion for research literacy. And I believe deeply, and I think you agree, but I believe deeply that it starts in entry level education and that for the most part, it's lacking in a lot of our entry level education. There aren't even requirements necessarily for research literacy. So a lot of times, massage students aren't given those basic things when they're in school. And then later, when they're starting to be in the field and they want to reach for that information, it's hard for them to know how to reach for it. So that's why I'd like to put a bigger focus on it in entry level work. And this podcast talks about that. So,
Yeah.
okay.
Excellent.
Right on. Well, where should we start? How about this? Why don't you talk about what research literacy is? Let's give a basic definition of what research literacy is and why it's important.
Sure. I think that's great. That's a great place to start. So research and conducting research is different than research literacy. And I mean, you absolutely have to be research literate to be able to conduct research. But just because one is research literate doesn't mean they are conducting research, right? And so that's one piece. But research literacy is truly meant to understand being able to be a consumer of information and research, to be able to understand how it is applied, what's appropriate to how to apply pieces, and to also be able to assess the integrity of the information that you're looking at based on, a basic understanding of methodology. Also, just being able to how to find, how to access. All of these pieces are part of literacy aspects of being able to access, find, assess, and apply it in meaningful ways.
And why, if I'm going to massage school,
Mhm.
why is it important to me to have basic research literacy?
So research literacy is really important generally, but particularly in that foundation training, so that to help give resource and access to be able to talk to others outside of the field, and to also get an understanding of how to find additional information beyond what they may be curious about, or to be able to tie implications to what it is that they're experiencing in class. And you're better able to speak around this. The foundation education in massage does not have a whole lot of time in many programs, right?
Right.
So many are 500, 600 hours, maybe 6 months, maybe to a year. But to be able to get some of these other pieces, to be able to see what's out there in the literature, how to find the information that is defining and making up our practice, and what it is, why it is that we're seeing the outcomes that are happening on our table, to be able to not only talk about it with each other, but also in the reporting back to the clients and patients, and then to be able to also talk with other health professions or other people who might be part of someone's wellness experience.
Right. I think that's great. And I look at from, you mentioned this, but from almost the most very basic level of when you have a client that comes in and says, can massage help with blank? Whatever. Can
Mhm.
being able to do something, because what I hear a lot of, and I know you're gonna go yes and have a lot of feels about what I'm gonna say, but I hear a lot of stuff like it's proven that.
Oh,
Right.
I hate the word proven. There's evidence to suggest, there's evidence to support, because as soon as you start proving something, there's going to be evidence elsewhere that discounts it.
Right.
So it's
And
about
it's
weighing the evidence, it's about weighing the information, right?
right. And one of the things that I attribute this, I think other people have said it, but I re first heard it from ABK is um, anecdote
That's
does
Anne
not.
Blair Kennedy.
And Blair Kennedy, sorry. Does, the plural of anecdote is not, the plural of anecdote is not data, right?
Right.
And so what happens is I hear this a lot. I hear people say, well, I know it's proven because I've seen it with my clients. And that sentence is a problematic sentence. And so
Yes.
when we can say things like there are things that happen on the table that we maybe can't point to the evidence for it, and but
Hmm.
we know it exists, but then I just want the language to be clearer when we're saying this is proven. What does that mean? Let's not say
Hmm.
it. And let's not say something is a fact, or I don't know, you can speak to this better, but I want,
Positive,
yeah.
maybe, like this definitely leads to this, right? So I think another important piece around research literacy might be well described with an example in my own world. And that was when I was in practice. I'd been in practice for a few years, and I had a situation come to me that I had never experienced before, and it was working with somebody in the final months of their life. Somebody who would be able to come to their home and do these pieces. But I had never worked with somebody with such advanced age and in this particular type position. And so I didn't know how to, and of course, this was also in the early 2000s, where before a lot of open access resources and otherwise. So the only way that I knew how to go and get information was to find textbooks or books. And so I went to the library and I looked in card catalogs, and I went and looked in indexes of books to try and get information on, how do I even approach? How do I go? What questions do I ask? How do I do these things? And somebody who is literate in the way, like has good research literacy, they would be able to go and access some of the sources that are evidence-based, be able to know how to use PubMed, use Google Scholar, how to find resources that would help to inform clinical decision making in our field and realm, because we don't have time in
Right.
foundation education to get all the different types of populations and all the different types of approaches. So research literacy in part also is a systematic way of finding evidence, information that can help inform our practice in a good way.
And I want to say that that is to me one of the keys. I want to say that sometimes the word research feels daunting to people and feels big and
Mm.
feels all this stuff. And it can be. You can get very advanced. It's what you do. You can be doing research studies. But if the only thing that ever happened, ever, is that a student had basic research literacy to be able to do what you just talked about, that's it, just to inform their treatment. If that's all that they ever used it for, that would elevate their what they're doing. That would elevate what they're bringing to
Absolutely.
the table. So there's not a need to be like, I have to be a researcher. In fact, those are two different things, as you said in the
Yep.
beginning. So there's no need to do that. Just if being able to say, I want to elevate my practice by being able to know where to look and not feel like it's daunting and have the basics of reading a study and seeing what does it say to me. And it's basic because I know as soon as I show a student a study, there's an overwhelm of how to look through that. And the basics of research literacy can just help to combat that a little bit. So I think that can be
Yes.
the end of what you know about research, and it can make a dramatic impact on your practice.
Absolutely.
Yeah.
Being able to discern the information and that you're receiving or that you're looking at, being able to in novel situations,
Right.
perhaps being able to get protocol possibilities, things to think around. I mean, this is a great place, and we'll talk about it more later in case reports
Right.
when they're really nicely articulated. This is what happened in this particular instance that you might be able to pull in. Um,
Exactly.
yeah.
Yeah. So let's go to what we offer at the foundation, because one of the things that I'm really passionate about
Mhm.
is what we have available at the foundation for schools, for instructors and schools that want to increase research literacy. Because that's another thing I've seen instructors say, well, I don't have research literacy, so how could I teach it? We have resources that can help, right? So let's talk about a couple of them and then we'll dig a little bit more. So I want to introduce just a few things. On our website is a tab that says education, and under that tab are several things. One of them is this podcast, the Research Perch. So even just recording this podcast, this particular episode could be the start. You could show this to your students and say, this is why research literacy is important. So the Research Perch has some fun things on it. Under that tab, there's also something called the Basics of Research Literacy course, and it is 3 hours. And it's just a course that you can give to your students. It's available, and they can watch that on their own time. They can watch it in class together, whatever. But that is a 3 hour course that just covers the basics of research literacy. So there's that. And then there's the research webinar series, which is a more extended version of that that gets into some details. So those are just some high level things. We can talk about them more. But what I want to talk about I was going to have you talk about case reports in a minute, but go ahead.
Yeah, well, I wanted to talk a little
Yeah.
bit more about Research Perch if we can.
Yes, please.
Yeah, so Research Perch has actually been around for over a decade now, and so it has a lot of content that is still applicable because when it first started, it was Ruth Warner and we were taking different articles, research articles that were published, and we were breaking them down almost like a journal club, breaking them down and then talking about ways that it's applicable to practice and how anybody can incorporate the information learned from those pieces. So it's, 20-minute to 30-minute little nuggets of, and you can go to the Research Perch part of the website, and it has a whole listing of all the different topics and looking at the different case reports, the different populations, the different studies that were coming out. And that's a great little pieces that you can incorporate into fundamental training pieces. Makeup work
Yeah,
is
it's
a great
great. Yeah.
great way for that when they're trying to do clinical decision making,
Mhm.
stuff like that. Yeah, those are all great.
There's so much. I've used the Research Perch several times in my curriculum to just say, listen to this or listen to that, or I've used it for makeup work, and I've also done assignments based on different episodes. And I think that can
Ah,
be
yeah.
fun. There's lots of neat stuff you can do. So Research Perch has so much available. And I know also this is a side note, but more schools are moving towards online education or at least hybrid education. And
Yeah.
being able to share a podcast, it really can support that in cool ways. So I love
Hmm.
using it. Okay, so those are some of the main things like this, the basic research literacy, the research webinar series, the research perch. But we have this thing that I love, which is the case reports. And I love them. I love that. And they are student, you can be a student or a practitioner. But for the students, they can do a case report during while they're in school. They need to put it in before they graduate. But I want you to talk about what a case report is and why they're cool, because they are.
They are. They're super cool. This is an area of my research, for sure. But going back to your, like, it can serve as a really lovely capstone project for a student because of all the different pieces that is part of a case report. It is essentially a reflection of something that happened in practice. When you're looking at the evidence pyramid of different types of research, case reports are at the very base of that research pyramid as part of it's above anecdotal, it is above opinion and professional opinion because it is documentation, systematic documentation of a case that's happening within practice. Different from a case study. A case study is a hypothetical or potential situation that actually occurred that is being used as an example and then broken down for education purposes specifically, versus a reporting of um, the condition, the treatment, the intervention, and the outcomes of something that happened in practice. So case reports are used throughout medical history. In fact, the first reportings of AIDS was in case reports of, this is something novel that's happening in practice. And different physicians were writing these pieces up. Other like Zika virus and things like that happening in case reports as well. So there's something that's interesting that happens in practice. And when you talk to massage therapists all the time, they're like, oh my gosh, I had this case when. That is a key indicator that that would be a novel and good case report.
Right.
Um, so the different components of a case report include a background section, which when you're reading these in journals, if they're published, reading them in journals, it gives you a background of whatever the condition or whatever the situation is. And then the actual case presentation goes through the information that happened with the person who's shown up in your treatment room, what sorts of treatments they've already had before, what it is that they're experiencing, what you observe. And then there's a documentation piece around what the intervention was, what was the treatment that was provided. If it's a series of treatments, there's different ways that you can document that over time. And then how you were measuring whatever the outcomes were that you were reporting on. So
Right.
those are the different components, but as a capstone project, a case report allows a student to be able to address a condition, understand by going in and looking at the literature of being able to write, why is it important? How many people does it affect? How is it presenting in this person? And then also to be able to document clinical decision making and outcomes. So it's essentially, going through whatever sort of reporting, if it's a case note or a SOAP note or what have you, putting it into that more formal form.
Right. And I think it covers, especially for entry level education, it covers everything you're learning anyway, right? It's a great way
Mhm.
to take what you're learning and put it into practice. Intake, documentation, checking in with just basic stuff, checking in with
Observation. Mhm.
before, observation, checking in with the client afterwards, looking at things. So it's taking, you've learned all these things, these basic things, right? How do you document? How do you do? And for schools that have clinics, which most schools do have a
Those
clinic,
two. Mhm.
for schools that have clinic, it can weave right into there. It doesn't have to even be extra. There's you can use your clinic clients and you can
Mhm.
be right in there. So I think it just weaves beautifully into a curriculum that's already there and lets you practice what you've learned, like really practice what you've learned. Sometimes this is the nature of all education, and I understand this, but sometimes our too much of the education lives in the hypothetical, and not
Hmm.
not the doing. And so case reports takes all these things you've been learning and then has you do them in real time with a real human. And I think that is really beneficial. So
For sure. Well, and the fact of the matter too is not every person's case report is going to be of the utmost highest quality. But there are going to be some people that it really resonates with.
yeah.
And for those folks who put together really elevated, great case reports, for a true novel situation, and this is again, because we can't control who comes into the clients, the student or the student clinics, but we have the case report contest that
Yes.
they can make a submission to, and they can actually win money and get published.
Which is so cool. So cool.
Yeah.
And come to the convention and talk about it there. If there's sometimes
Hmm.
there's windows for that. And there's a launching place for that, for many things to happen from a case report. Now, again, I want to say it doesn't need to. To your point, you can just practice something doing a case report, and that can be enough. But for
Yep.
those students that it really resonates with, it's a great little launch pad to some cool things that happen. So I love the case reports. I think they're really cool. All right.
Yes. And so I want to do a little point, and that I'm going to also pull to another piece around research literacy, an important thing for folks to know about, and tie all of these things together. So there is a research journal called the International Journal of Therapeutic Massage and Bodywork, or IJTMB, and this is the Massage Therapy Foundation's peer-reviewed journal. Now, in the journal, back in 2014, I believe, there is a TMB, which is Therapeutic Massage and Bodywork, TMB adapted guidelines for writing case reports. And there is a case report guideline for medical case reports. And way back in 2014, a colleague and I got together and we adapted those medical case reporting guidelines for massage therapy. And in that article, which I'm sure we'll have linked to this research perch, the table 2 outlines exactly what should go and in what order into a case report that can be used almost as a rubric
Yeah,
for grading. And
mhm.
I think is the basis for the scoring rubric for the
It
contest, if
is.
I'm
And
not
that
mistaken.
scoring rubric is on the website. So you can see the scoring rubric and use that as your
Yep.
grading rubric. Yeah,
Yeah,
perfect.
absolutely.
Mhm.
So those are all great ties, but then the IJTMB has been a wonderful place for massage therapists to actually get their case reports published. And I continue to remain a huge advocate for getting as many of these published as possible, because that's the way that it gets disseminated to folks outside of the field and to others.
Yep.
It also goes through a peer review process, which improves the rigor and the validity of of the work being published. And it also allows for, in IJTMB, is open access, so that if a massage therapist like myself encounters something novel and new, but there's a case report written on it, you can go in, Google Scholar or PubMed. You can access that article in the moment. You don't have to pay a fee for it. There's not a firewall, and you can see what treatment approaches there might have been.
I want you to just say a couple more sentences about open access because I mean, you said there's no cost, there's no firewall, but I want
Mhm.
us to talk about that for just a second because that is what is beautiful about our journal and what it means that it's open access. It means it's free, but let's talk about how cool that is just for one more minute.
Yes. So the research publication, the way that that tends to work is based on subscription. Now, back in the day, when everything was paper journals, it was different libraries would have subscriptions. You'd have to go and flip through and go and find these different articles and such. But now, so many articles, and even if it's a PDF of an article, you can get those pieces online, but there's still cost associated with being able to access it or publish it or what have you. So an open access journal or open access research means that people who are consuming it, who want to read it, there's not a cost associated with it. They're able to access it and see it. However, open access tends to mean that the cost still has to get passed on to somebody. And typically in these open access journals, most of them, it costs to actually publish. So for the people who are doing the research or the people who are wanting to disseminate the information, they are, once they get accepted, it goes through peer review, then they have to pay a processing charge in order for their work to be open access in the journal. Else there's going to be a paywall for it. So our open access is different in that there's no payment or fee on either side. So not only does it cost for people to publish in our journal, um, readers of the information in our journal also don't have to pay a cost to see it. And this is because of the very generous support of Massage Therapy Foundation and also our colleagues up in Canada, the registered massage therapists in British Columbia. Yes.
Yeah. Perfect. Yeah, I just love it. It's a great thing. I love to do assignments out of the journal. So I want to talk, we've got just a couple minutes left. So I just want to talk about a couple things. Did we miss anything big you want to talk about?
No, we got
Okay.
Research Perch, talked about yep.
So I'm just going to talk about a couple things I like to do in the classroom. One is I love to give Research Perch episodes for people to listen and discuss. Okay, that's a easy, like you said, makeup or just a great group discussion, right? I
Mhm.
love to have people pick something they're passionate about. Maybe they're passionate about Parkinson's or low back pain or dementia, or it doesn't matter, whatever it is, chronic pain, and see what they can find in the journal around what they're passionate about, and
Mhm.
then talk about what they found, and just learning how to search PubMed, Google Scholar, IGTMB, just be able to learn how to search for that and say, what is
Mhm.
this telling me? Even that right there is just a great lesson on how to get comfortable finding studies, right?
Yes.
Those are a couple,
Yes.
yeah. Go ahead. And do you have it? Was there anything you like to do?
So I look at the pictures. So pictures are so important, and pictures are the tables, the figures that some people really resonate with that. Other like Ruth Warner will be like, "Oh my God, Nikki," like, ah. So she doesn't like looking at the picture parts because that
No.
sometimes gets a little bit, especially if it's the tables and data and p-values and things like that. She's not as interested in that. But I tell you, there are some pieces that, depending on what kind of study you're looking at, like if it's a systematic review, the picture is a great big table that has all the important parts of the article of the different papers that it's reviewing all organized for you to see. Like you can see who the population was, you can see what the major outcomes were, all of those things. One of the other things that I like to tell folks is that, if you don't have a really great understanding of statistics or that feels overwhelming to you, don't feel like you have to read and understand every single sentence of a research paper and a research article. The discussion is really pertinent and really important. And, just the results should just be saying, like, what are the outcomes of whatever it was that was being tested or the
Yeah.
information that was being gathered, sort of that synthesis piece. But the discussion is the so what. So your abstract, your introduction that's giving you all the background, and your so what, that gets you really, really far in most of your papers.
Right. And that can be I just love what we're talking about really is getting your feet wet in the
Mhm.
research world. That's all that it is. Some basic research literacy, some being familiar with how to find a study, how to find a paper, whatever it is that you're looking for, and how to basically read it. That's it.
Yep,
And it's a great entry. It's a great thing. And it makes, I just think, as I said earlier, it elevates what you're doing in your practice. So
yep.
that's
And
a
it can also help you find and understand what gaps are there. So
yes.
that while you say, so there's not a whole lot of information on that right now,
Right.
but now other where other places are to where maybe clinical experience is the best information that you can get from that. So then seeking out those who work with that over and over, or look to other fields that you might be able to get information about that particular population or concern.
I think it's great. I know that you and I could talk about this for a couple more hours because it's
Later.
our passion. But I think that was a great basic just thing of what the foundation offers. I'm available if people want to email. Please feel free to email me. My email's on the website. But that's just a great place to start for instructors or schools that are looking to increase their research literacy in their current program. And we're excited for what you make of this podcast. Anything else?
Yes, and let us know. Let us
Yeah.
know how our resources are being used. That's always and consider helping to support the continued development of these things. That would be
Yeah, we would
wonderful.
love that. We would love that. I always talk to my students about that the Massage Therapy Foundation is reliant on our donors, and we appreciate any contribution in exchange for all these benefits that we've got. We love it.
Yes, wonderful
Okay,
resources that are being developed and available.
that's right. Well, thanks for being here, Dr. Monk.
Thanks so much for having me and letting me talk with you about your expertise and area.
We'll see you again. Okay,
Yeah,
bye.
bye.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.